I'm Jamie. I'm the PTNS champion here at Alliance Urology, where I manage this therapy prescribed for our overactive bladder patients. The most important part of my role is to deliver PTNS outcomes for our OAB patients. But I also run the entire program, so I have a 360 view of the patient experience. So while I'm maximizing the patient experience, I'm also managing the practice efficiently. For starters, I set the patient's schedule with the end in mind. So the patient and I schedule all 12 appointments up front. I do this around their availability and mine. For example, I schedule PTNS sessions back-to-back 3 days a week, leaving an hour lunch break. It's important for the practice to be flexible, realizing that 3 months is a big patient commitment. So I say, I'm here 8 to 4. When's best for you? If you're sitting with your leg up for 30 minutes at a time, you want to be comfortable. So we invest in these comfy chairs for our PTNS patients. Here at Alliance, we treat our PTNS patients in a private room, but some urology enterprises consider group therapy in large rooms, especially for their patients who enjoy the social aspect of visiting with each other. A big part of my role is to keep patients encouraged, but also to set realistic expectations. Studies show that up to 80% of patients improve in this therapy, while many patients will see significant improvements by about week 6. In a study of 150 patients, about 20% of patients didn't see improvement until week 8. Some didn't respond until week 12. I give them our bladder log so they can chart their voiding and use this to track their improvement between treatments. This encourages them to stay engaged. I document the patient's treatment into our Uro EMR and work with our insurance department to keep up with patient coverage. If the patient gets denied, I'll call to reverse and fight for them. I order supplies monthly to save time in shipping. Every time I enroll a new patient, I make sure I order a case of 12 leads to cover their treatments. I know some enterprises dedicate the case to the patient and write their patient ID on it. It makes sense to have a simulator for every patient room. I have 4 simulators, so that means I can treat 4 patients in less than an hour. I'm proud to run the PTNS program here at Alliance Urology, and we celebrate our patients' OAB outcomes. I'm living proof that you can see 60 patients a week and make a big difference in their lives. You can too.